Have you ever stopped to think that the medication you take with such confidence might be doing more harm than good? It sounds paradoxical, but it's the reality. Many of the medications we take daily, believing we're taking care of our health, could be putting the liver, that silent and vital organ, in real danger. And don't be mistaken, we're not talking about obscure or rare medications, but those you probably have in your cabinet right now. Imagine this. While you're trying to solve one problem, you might be creating another, silent and treacherous, affecting your liver health. Want to know which medications these are and, more importantly, how to avoid them from harming your health? Stay with me, because what follows might change how you view your own treatment. Common medications and liver damage. When we think of medications, we often forget that the liver, this small giant of our body, bears the weight of processing everything we ingest. And here lies a critical point. Some widely used medications can end up putting our health at risk, especially the health of our liver. We're talking about medications like Amiodarone, Amoxicillin-Clavulanate, Diclofenac, Tylenol, and statins. It's like each of these is a disguised enemy soldier, infiltrated in our body's defense line. Imagine this. You're taking something to improve one problem and, unknowingly, creating another. That's why it's crucial to understand how these substances interact with the liver and to watch out for the signs your body gives. After all, who hasn't taken Tylenol thinking it was harmless, right? Now, imagine a person who takes a pill a day, thinking they're taking care of themselves, but without knowing they're fighting a silent battle against their own health. The truth is that many of these medications have the potential to cause liver damage, and the effects are not always immediate or obvious. A classic example is the use of Amoxicillin-Clavulanate, which, despite being a common antibiotic, can trigger serious adverse reactions in the liver. Hence, the importance of regular checkups, liver function tests, and, of course, the good old caution. A simple blood test can be the thin line between maintaining health and developing a bigger problem. And speaking of tests, let's take a closer look at how Amiodarone, our next villain, can impact your liver. Number 1. Amiodarone is like that medication you think is doing wonders for the heart, but can quietly harm the liver over time. Mainly used to treat irregular heart rhythms, it is effective, yes, but not without its own challenges. The FDA has already warned, use with caution and closely monitor liver function. Imagine the medication that regulates the heart ending up being the cause of liver failure. That's why anyone using Amiodarone continuously should always keep an eye on liver function tests. Small symptoms, like unexplained fatigue or a slight yellowing of the eyes, can already be signs that the liver is overloaded. This is where prevention becomes important. Many people don't know, but a diet rich in antioxidants and anti-inflammatory foods can help the liver cope better with the impact of these medications. Including superfoods like ginger and grapes in your diet can be a good step to strengthen this natural line of defense of the body. And, of course, there's always that talk with the doctor. Do we really need prolonged treatment with Amiodarone? Or is there a less aggressive alternative for the liver? Reflection and information are the keys to keeping liver health in check while treating other problems. Speaking of antibiotics, let's better understand what Amoxicillin-Clavulanate can do to the liver. Number 2. Amoxicillin-Clavulanate, that antibiotic that often seems to be the quick fix for infections, can be a real test for the liver. Although effective in fighting a wide range of bacteria, it is not without risks. For some people, especially those with sensitivities or allergies, this medication can trigger an immune response that results in liver damage. The problem is that this damage can appear unexpectedly, often going unnoticed until the symptoms become more severe. A simple medical consultation and liver function tests can prevent major complications, making them essential allies in the journey to health. For those who don't know, the liver is the body's great filter, and when it is overloaded with medications like Amoxicillin-Clavulanate, it's like trying to pass sand through a coffee filter. At some point, it will clog. A practical example is including foods like oats and fennel seeds in your diet, which help with liver regeneration and can ease the liver's workload. And it's never too much to reinforce. Self-medication is a shot in the foot when it comes to health. So, it's always worth reflecting before rushing to the medicine cabinet. Now, let's take a look at another common, but equally dangerous medication for the liver: Diclofenac. Number 3. Diclofenac, popularly used to relieve pain and inflammation, is one of the most common anti-inflammatories on the shelves. But, like everything in life, it also has its dark side, especially when it comes to the liver. The problem is that, despite being an ally against pain, Diclofenac, particularly in its oral forms, can overload the liver in the long term, causing serious damage. And it's the same old story. What starts as a medication to relieve a punctual discomfort can turn into a chronic problem if not properly monitored. Therefore, anyone using it for an extended period should always include liver function tests in their healthcare routine. A practical tip for those who need to use Diclofenac is to always consider less aggressive alternatives, like dietary adjustments or practices such as using compresses and stretching to relieve muscle pain. Additionally, integrating foods with natural anti-inflammatory properties, like ginger, into your routine can reduce the need for medications. After all, the liver already has a lot of work just with the body's daily functions, so giving it a break whenever possible is a good deal. Speaking of rest, the next on the list is Tylenol, which many consider harmless, but also has its pitfalls for liver health. Number 4. Tylenol acetaminophen is that familiar remedy that almost everyone has at home, ready to relieve pain and fevers. But what few people know is that, in doses above the recommended, it can become a real villain for the liver. Acetaminophen, its main component, is safe when used correctly, but a simple mistake, like taking more pills than indicated or mixing with alcohol, can cause the liver to suffer. And the line between the safe dose and the dangerous one is very thin. Therefore, it's always good to remember that the abuse or chronic use of this medication can lead to serious liver damage and, in extreme cases, the need for a liver transplant. A practical way to avoid problems is always checking the dosage and never mixing with alcoholic beverages, a combination the liver definitely doesn't like. For those looking for alternatives, it's worth considering non-medication methods, such as proper hydration and rest for mild symptoms. Small adjustments in daily life can reduce the need for frequent pain relievers, thus preserving liver health. And, of course, always pay attention to labels, as many other medications contain hidden acetaminophen. Now, let's talk about statins, which, despite being essential for many, also have their issues with the liver. Number 5. Statins are like that friend who helps keep cholesterol in check, but, in some cases, might end up taking a toll on the liver. Used to manage cholesterol levels, they have a history of being effective and safe for most. But it's important to remember that, in some cases, they can cause mild elevations in liver enzymes. This usually isn't a big problem and tends to be reversible, but it's a sign that the liver is working a bit more than usual. Therefore, liver function tests before starting treatment and during use are recommended to ensure that liver health is not being compromised. For those taking statins, maintaining a healthy lifestyle is an excellent way to support the liver and enhance the medication's effects. This includes choosing lighter foods and engaging in regular physical activity, which helps keep cholesterol at safe levels without overloading the liver. And for practical tips, adding foods like oats and grapes to your diet can provide fibers and antioxidants that support liver health. With that, we close this cycle about medications and the liver. But there's much more to explore when it comes to protecting our largest internal organ. After learning about these 5 common medications that can damage the liver, the question remains, what will you do with this information? Continue using these drugs without a second thought, or adopt a more careful and proactive approach to your health? The truth is, Taking care of the liver is taking care of the whole body, and small changes can make a big difference. So, how about starting to pay more attention to the signs your body gives, reviewing your habits, and maybe even discussing safer alternatives with your doctor? Don't put off for tomorrow what you can start changing today. Now, if you want to keep learning more about how to keep your liver healthy and protect yourself from serious problems, subscribe to the channel and turn on notifications so you don't miss any content. And speaking of protecting your liver, have you seen our video on the 5 early signs of liver failure? Don't ignore the warning signs from your liver. Learn to identify the 5 early signs of hepatic collapse and protect your health before it's too late.